Zealand, Australia, who have told us that they are interested, but it's very late for them to join. So this meeting will be recorded. And also because I know that we are all from different countries and with different languages, we also wanted to give a chance to have subtitles. We cannot have the automatic translation when we go into the break rooms, but in order to have this translation as captions, you have, I don't know if you see here, but on the right side of your Zoom, you may have to press the three buttons, the three dots, and you will see there is something that is called captions, and you will have to follow these 3 steps in order. First, you turn on translation. Second, hopefully the speaking language will appear as English, and that's this language that we are gonna be speaking all the time. And then you decide what language you want it to be translated to. Be a little bit patient because sometimes it goes a little bit slower than when we are speaking. And if we are speaking too fast, that happens to me quite a lot, and you don't have the time to read the captions, let us know and we will go slower, okay? And after the general information, let's give it a start. So today, as you have all seen on the emails, we are coming here to speak about precision medicine and especially about precision oncology. We have the luck to have good number of people who's going to help us through the session. Some of them, you can see them already with their camera on. So I'm Celia. I'm the person who's going to be speaking on the next minutes. I'm an oncology nurse. I am based in Spain, and I'm part of the steering committee of GPON. And I have the luck to be with Sylvia, who is member of EONS, the European Oncology Nursing Society, part of the education working group. And I'm also here with Julia Chalinor and Ariesta Milanti, who are both members of GPON, one on the steering committee and one of the advisory committee. And also we have the luck to be with 4 members of FT3, that are Silvia, Leonora, Osioma, and Isha, who you will, depending on what separate rooms you go to, you will be accompanied by one of us and one member of FT3. So after a little bit of welcome and introductions and a little bit of general information, I think it's good time to refresh or to tell you why we are here today. So we are 2 different organizations, one full of nurses, that is GPON, and we all came together because we have the vision of empowering nurses, and we want to empower them together. So as a multidisciplinary team, not only medical professionals. And when we were speaking about precision oncology, that is what FT3 centers, that is going from targeted treatment, that it's accessible for everyone. It's very important for it to be accessible for everyone, that the healthcare professionals that are actually working with this precision medicine or with targeted treatments, you may hear us speaking about different terms, that we all understand what we are talking about and that we are able to actually translate this information for the patients. So together, we join together in this to understand and access the challenges that we face, to empower us, nurses, to take a more active role into the clinical decision-making and especially into patient advocacy, to improve our collaboration, not only between us, but as well with other healthcare professionals. And of course, to make sure that we all understand when we are speaking about these different terms, that we all understand what we're talking about. So for me, it's an honor to be able to be doing this first seminar. And as you can see, I already forgot that we're gonna do a poll. So we want to also meet you. So we would like to ask you to please put who you are, what is your role, so where are you working, and what country, where are you based? That way, not only us, we will be able to a little bit meet each other and know where we're coming from. And while you answer, I'm gonna carry on and I'm gonna give you a little bit of time to answer. So my first question, before we actually go into the terms that I already throw some of them to the board, it's how familiar you are with the concept of precision oncology. And we think this is quite important because you will hear a little bit more afterwards, Eleonora speaking about the nurse's perception, but we already have a perception that we all understand different things when we speak about precision oncology. So how comfortable you are with the concept of what precision oncology is. So we're going to put a poll here so you can vote. And to try to answer slightly or to try to improve however we all feel, one of the things that we have decided to do today is we will go through all the information about what precision oncology is, the targeted treatments, and then we will get into this discussion about how we all feel about dealing with these terms and speaking with patients. And then maybe possible solutions that we can bring to our actual places of work to improve how nurses are involved in precision oncology. But first of all, let me tell you a little bit what GPON is and who we are. So GPON, it's Global Power of Oncology Nurses. So it's a group of nurses that we try to connect nurses worldwide. Especially, we try to bring more connection and more opportunities for us to share from low, middle income, high countries that we can actually be together. One of the things that we do every year in November is we do a conference that it's online so everyone can join. And we normally do it in 2 different timelines so people can actually join regardless of where you are. For this, one of the things that we do in this conference and as GPON is to try to learn from each other, try to listen from people that have addressed challenges that may be completely different, but at the end sounds very similar, like staff shortages or crisis. We had a lot on COVID that was shared by all of us, but there are things like, for example, when it's a big flood like we had in Spain a few months ago, or when we had a volcano in another part of the world, to listen how actually nurses are so creative with very little resources to actually achieve and give patients what they need. So we try to provide that education and collaboration. One of the things that we are doing right now is this one. As a education and collaboration, we are collaborating with FT3 to bring a little bit more of precision oncology for all of us. And we like to celebrate each other. We like to see how other people have achieved things, and we like to learn and listen from your experience. So I really looking forward to listen and learn from all of you, and not only listen to myself. And of course, we have spoken a little bit of who GPON is, but I'm going to invite Sylvia to tell you a little bit as well of who FT3 are.
Thank you so much, Celia, and hi everyone. Very excited to see you all. My name is Silvia Bornego. I'm Associate Program Director, and I work in the From Testing to Targeted Treatment program since its very inception. Just for you to know, FT3 is also a global program. It's a multi-stakeholder, so we really have different types of stakeholder around the tables, including the patient community, but also healthcare providers, pharmaceutical companies, and so on. And the people that we have in the program are really motivated by collaborating for improving patient outcomes, by bringing to life the potential of personalized healthcare. So FT3 really wants to help accelerate solution, learnings, and best practices. So this is why we found it such a great idea to actually collaborate with GPON and we all today to really try to go one level deeper into what is the role of nurses and how can we really help nurses to improve patient outcomes, because we do know and we hear often that nurses can make a big impact in at the point of care, in making sure the patients not only receive the best treatment ever, but also are aware and can actually be part of the treatment decisions. So we're happy to be in this call today, and we really hope that this forum can create the opportunity to really broaden the perspective, but also listen from each other. There is a lot of expertise and knowledge as part of this community, and we just want to bubble it up and see how can we learn from each other, but also think about what can come next. How can we turn our, collecting learnings in collective actionable insights and solutions? So happy to be with you today, and I will turn it over to Celia again.
Sorry, a few months ago, when we were sharing on a WhatsApp group of GPON who wanted to share their experience on precision oncology, we did realize that we had to start by explaining a little bit what precision oncology is. So when we speak about precision medicine or precision oncology, we have to think about, let's think about two people that have been diagnosed of the same disease. And I always give the example of breast cancer. But their own experience, how they feel, how they experience side effects, how the treatments that they have are actually not the same ones. And what we try with this precision medicine is that actually we look at the person, not just who we are, like as a disease, but all the different characteristics to realize that we are all different. So we may look very similar, but our genes, our environment, and our habits are completely different. So when it comes to the characteristics and how can that affect, so that characteristics can affect the patient general health, including the disease they may develop, as I was saying, the symptoms, and how they respond to certain treatments. So if we were to, now we take out the person, we take that breast cancer, we look it in the laboratory, we take one of the blocks of that breast cancer and we look at it, it may actually look very different from one person to another. What precision medicine tries to bring is that even though this diagnosis may be the same, we try to put a unique personalized treatment for the person. So instead of giving, as we used to do, the same chemotherapy to every person with a cancer diagnosis, I like to explain it in a way that we used to know the name, but we didn't know the surname of the cancer. So now we like to try to look for a treatment strategy that is based on that genetic profile of the person or that genetic profile of the cancer. So precision medicine allows us to go to the right medicine for the right patient at the right time. And it looks very similar to what nurses use when we are giving treatment, that we have our right time, right dose, right person, right treatment. So it's making it more for the person. And what is happening with precision medicine nowadays? So precision medicine relies in one thing that another word that we use a lot, that it's the identification of biomarkers. And what are biomarkers? Well, biomarkers can be different things. It can be genes, proteins, it can be another biological molecule that can help to identify, as I was saying, that surname of the disease. And the truth is that nowadays, those biomarkers are allowing us to research and develop new targeted medicines. And if you look here to the right side, you can see that since 2006, it's not like I'm going to 1999, there is more and more targeted therapies available. We are thinking that in 2020, 40% of the clinical trials in the US were about biomarkers, compared to 5% of them that were in the beginning of 2000. So the number of targeted therapies are rising, and we do see that on clinical practice, because that means that same person with what it looks like same diagnosis actually have different treatments. But it also it has other benefits, because different patients can benefit from these new treatments. So we are seeing people that are living longer, that are having less life-threatening side effects. and that are surviving also for longer with a better quality of life. And targeted therapies for cancer. Nowadays, as I was saying, it's becoming a reality. So I know you may not be able to see, and we will send these slides with more information just to let you know. But if you see that map, that I know it's very difficult to see, but it's now, this is already maybe too old. Because we can see that almost here in the top, it has head and neck, renal, breast. And on those wards that are barely visible, you can see very different names of treatments that are targeted therapies. So this is really important for us to know. Also, because as an oncology nurses, we are mostly the responsibles of giving these treatments. And when we understand how different they work in our body, we can also understand how that body may react to them in a different way. So patients do have questions for us about why this person, for example, with the same diagnosis have a different treatment than mine. Is it better? Is it worse? Am I feeling better or worse? So I'm already thinking of or trying to explain that we are involved in all of this information with the patients. So as I was saying, and we go to the next slide, the precision medicine is becoming a reality. And it's especially nowadays used in metastatic cancers, but we can see it used in cancers that are not metastatic as well. And again, I know that this slide, it's not the biggest, but you can see how the trends are rising. That's the only thing that I want you to see in this slide. How the testing rate is becoming such a normality that in early 2000, we barely tested a couple of things about lung cancer or colorectal, and now we are using it for so many other cancers that it's just rising on the top. Now there are so many things that we cannot imagine on treating someone without knowing. And one of the examples that I give, and it's not metastatic cancer, it's cancer per se, it's breast cancer. So I feel that for most of us, it's almost unimaginable to think about treating a breast cancer without knowing the HER2 status or the hormone status of that cancer. And here we are already speaking about biomarkers. And it is really important to know it, because when we know that this person has this HER2 positive, there are treatments that we can add. So in this case, it's not that we are changing one treatment to another, but we are adding a treatment that it's allowing the patient to have a reduced rate of the cancer reproducing. So it's allowing us to help. And there are many other examples that I will try to give you. And as I say, I normally use breast cancer because they are much known. There is more education around breast cancer, but melanoma, lung cancer, it's now another unthinkable without biomarkers, but these biomarkers are still changing. Not all the biomarkers are available in every country. Not all the treatments are available in every country. And that's one of the things that we want to understand when we stop and listen to you. So how precision medicine can support cancer care? So as you have seen, I speak mainly about oncology, but precision medicine is not only about oncology. But centering in my area, that is where I feel comfortable when we speak about cancer care, we can think about testing different things. So I'm going to stop for a second to speak about biomarker testing, or what we call somatic mutation, and genetic testing, or what it's called inherited mutation. Okay? So when we speak about biomarker testing is when we actually test the cancer, so the tumor per se. We want to know what unique characteristic this cancer has. The example that I already gave, HER2, is one of the things that we can look. Can you go to the next slide? So biomarker testing allows us to identify these mutations to the cancer. And it not always contributed to a different diagnosis, but it helps us to know, for example, how aggressive this may be. And it may also help us with the treatments. But it tells us a characteristic of a cancer, not a characteristic of a person. When we speak about genetic testing, the genetic testing is something that we are testing on the body of the person. So we do a blood test to see if a unique characteristic of the gene of the person has a difference to what the rest of the people are. And that not only help us with the diagnosis sometimes or most of the time, and not only may help us with some targeted treatments, it also allows us for prevention, not only on the person, but also on the family. Because the difference between the biomarker testing and the genetic testing, or the mutation of a tumor and the mutation of a gene, is the mutation of the tumor. It's only on the tumor. You cannot give it to someone else. So if your cancer is HER2 positive, your daughter does not have a biggest probability of have a HER2 positive breast cancer. But if your breast cancer has a BRCA2 mutation that it's also in your genes, not only in your cancer, your family members may have an increased risk of having breast cancer because they may have inherited the BRCA2. And I insist the may, because as we all know, you may all have a father or a mother that have beautiful curly hair or beautiful blue eyes, but we don't have it. I don't have the curly hair, I don't have the blue eyes, I have that on my family, because inheritance is a chance. So when we think that we have identified an inherited mutation, we need to look in the different family members if they do also have that mutation. When we find a mutation that is in the cancer, we don't think about the family, we think about the person. But then we join them together. Because actually, identifying a somatic mutation or identifying an inherited mutation may allow us to choose the right targeted therapy to either treat the cancer or stop them from growing. And it also, that targeted therapy, normally it's less lesive, so it causes less damage to the normal cells than other treatments. One of the examples that we wanted to put here, and why one of the examples that is helping us to develop those many targeted treatments, is the Human Genome Project. So obviously, from when the DNA was discovered to now, we are still discovering different genes and looking at the whole human genome. This huge project that has been done, and it's still continuing in many countries in different ways, is allowing us to understand that distinct, unique things from each individual that may allow us to treatment in a different way. For example, nowadays, we are precision medicine, it's allowing us as well to know the dose of treatment where we cannot go up for someone to have less or more side effects. So I have kind of summary, a little bit of how I could know about biomarker testing. And when can we do biomarker testing? Well, biomarker testing, it's useful in many moments in the cancer phase. One, before diagnosis, we spoke about prevention and that inherited part. So a person that may be at risk of cancer. So even allow us to go as far away as prevention. Obviously, it helps us with diagnosis. As I said, it helps us to put that surname to the cancer, to know the difference, to know how aggressive they may be. It's especially relevant, and it's where we see it most after a cancer diagnosis, to allow us to choose a treatment, to calculate the dose, to think about the possible side effects that may help us also to decide whether we want to give one treatment or another. That happens a lot, for example, nowadays in pancreatic cancer, that we may make a decision about not giving a treatment that we know it's good for pancreatic cancer because a person may react really bad to that drug, and we want them to be strong enough to continue the treatment. But it also allows us to look at how the cancer is responding. So during treatment, as you can see, there are many things that we can look at. But not only that, what about after treatment? It also allows us to monitor, to kind of calculate a little bit better than before that risk of recurrence. So this is a very tight summary of how biomarker can be useful. But actually, how are we testing it? Well, there are many different ways, but obviously we need to start with a person. So we start with a person. And with that person, we need either a blood sample or a tumor sample. And it depends on what we want to test. We may want to choose one or another. It doesn't matter if you do a blood sample or a tumor sample, it has to go to a lab. We need a pathologist. And that pathologists have different ways of testing. I'm not going to get into detail to that because that will drive us a little bit crazy, all of us. But I'm hoping that will be a future thing to look at. But when it goes to the laboratory and the pathologists look at it, it looks at that biomarker identification. So we know the name of the cancer. Now we know the surname of the cancer. We know the characteristic of the person and the characteristic of the cancer. We can choose the treatment, the right treatment. So if you look at that sentence, that it may be very long, but it's very important. It's actually how precision medicine is helping oncology. Help the patient and their healthcare team to make fully informed decisions about a cancer treatment. Help the patient and the healthcare team, not only the healthcare team, to make decisions for the patient. And what happens after someone has actually been tested? Well, as I say, after they are sent to the lab, and after the lab has actually identified that biomarkers, they write a report. And that report gives the information normally to the oncologist about that different biomarkers that may allow us to choose one or other treatment. It's true, and it's very complicated for patients nowadays, that this testing takes longer than just the diagnosis. So sometimes people have to wait weeks, and it's very difficult to wait when you don't understand why you are waiting and why we cannot give a treatment just right away. And that's another key moment for me, for nurses to be involved in it. That is that moment of anxiety on the waiting, like why we call patients, because you need patience. It is extremely complicated to wait for things to happen that you don't understand what you are waiting for when you just want to tackle that cancer. You just want it removed. You just want it treated. And we can help people to understand that that waiting period may actually give them the chance to help them a little bit more. So, a little bit of summary of what precision medicine is. So, I wonder if someone has any question, and if you want to know more, but also we would like to know if precision oncology is something that you think it's available in your facility. And as you may see, you have different answers. It may actually, you know that it's available in your country, but not in your facility, or not available at all, or something that is coming. So we really want to know what is happening. And if someone has any question, you can pop it in the chat. But I can already see some differences of people that have it available in your facility and widely available in their country, or the people that are saying it's not available at all. So actually a lot of the things that we have spoken may be very new, or that is not widely available. I can see there is a similar, or that actually you know that it's available in your facility, but it's not in everywhere in your country. So it's not widely available. So we can already see, even though not all of you have input an answer yet, that we here have different possibilities in our countries and our facilities. And I'm going to say now, this is FT3 coming and saying, this is not right. Okay, because how can we all be in the same world and have such a difference? Or even in an own city or in a country, how it's possible that I live in a country where it's widely available in here, but if I go to the south or the north of this country, actually you cannot access it. So the dream is that cancer treatment, equitable cancer treatment, will be available for all of us. And we hope that one of the things that we bring here It's a little bit more of conversation of the necessity and how wonderful can be precision medicine for our patients. I'm going to hand over to Eleonora, who is going to tell you a little bit more about what they have learned from nurses and their involvement in precision oncology. Eleonora, the floor is yours.
Thank you so much, Celia. And thank you so much for the wonderful presentation. It was very insightful for me as well. And absolutely, as you said, the mission of FT3 and why do we exist as a program and as an organization is to ensure that we can allow equitable access to every patient, and that every patient can benefit from the right testing and the right treatment at the right time. And so when we were talking with our community and with our board, we have heard that one of the ways in which we can make this vision a reality is actually working towards supporting healthcare professionals to ensure that they are equipped with the tools and capabilities to implement precision medicine at the right time, at the point of care. And so 2024 for us was a very important year because we understood that in order to support healthcare professionals, we first needed to get their perspective and really hear it from them. And so we decided to take a step back and really map out what are the roles of all the healthcare professionals that are involved in cancer care, what are their challenges, what are best practices out there that are addressing these challenges, and what are the gaps that we can identify in the landscape. So we did a very complex mapping, and we will share more about it. This is just a summary slide that is very complicated to read, but we promise we will share a full presentation on this. We went through every step of the patient care. We tried to understand in every single step, what are the actions that happen, what is the role of every single healthcare professional, and what are the challenges in serving patients and making sure that we can meet patients where they are and fulfill their needs. And what we understood is that nurses have a pivotal role. So why are we focusing on nurses? Is because in our analysis and in our landscape mapping, we understood that within the care pathway, there are two healthcare professionals in particular, pathologists and nurses, that have a key role in ensuring that we can allow patients to have the best possible outcomes and access the right testing and treatment at the right time. But they're often under-recognized, even within the healthcare professional team. And so thanks to also the support of Celia, we decided to focus on nurses. And we have heard that nurses play a role in different steps of the patient journey. Just 4 key things that we know you as nurses do for our patients every day is you are responsible to empower patients and caregivers, and you support them in raising awareness of their possibilities and what their care pathway will look like. You also support patients in coordinating their care. So you facilitate communication among different healthcare professionals, and you facilitate communication between the healthcare professionals and the patients and the caregivers themselves. You are the main advocates for the shared decision-making for patients and nurse, and this is something that nurses play a pivotal role in particular in every single setting. So we have heard that nurses are the ones that really listen to patients and really take time to understand the background of the patients and the caregivers. And so you have the power to bring the patient perspective to the oncologist and to the full healthcare professional team. And you have the power to bridge between patients and healthcare professionals so that there can be a truly shared decision-making and patients can actually feel like they own their care. Last but not least, we have also heard that you're often responsible for the data collection and that you often manage and support patients overall. And so that is also a critical role, especially when it comes to precision medicine. So as you can see, we have really noticed how nurses can make a difference in patient care and can be one of the key figures to unlock better patient outcomes. However, we have heard that you also face a lot of challenges and that you're also often under-recognized within the team. We have interviewed some of you, and I see some of the people that we have interviewed in this call, and I really want to thank you once again. And we have listened to experiences from all over the world, and we have tried to go through literature and really understand what is your daily life and what are your daily challenges. And some of the things that we have heard in every single setting is sometimes you feel like you have a limited role in the clinical decision making. So you have a lot of knowledge, both when it comes to professional knowledge, but also when it comes to knowledge of your patients and of the caregivers and their setting overall. But this knowledge is often underutilized, and this impacts negatively patient care. We have heard that you face some communicational barriers, and this comes with talking to your patients and their caregivers and making sure that you are equipped with the right tools to really explain them how their care pathway would look like and what are the different options for that. But we also hear that these communication barriers are present within the healthcare professional team, and so that often you would like to be more involved and more consulted by your colleagues so that you can really bring the patient perspective. We have also heard that there is a huge challenge with resources and time. So we know that there is a global shortage of nurses, and this is really affecting how you can really deliver in the way that you would like to for your patients. And we have heard that the time pressures that are put on you and the amount of work that you need to deliver to make sure that your patients receive what they need is really huge. And so this is definitely a barrier that maybe we can explore more together. And last but not least, we also know from a lot of you that you see some educational and knowledge gaps, that you would like to see and receive some training that is specific to nurses, and you would like to have access to point of care resources so that you can really learn and understand how to support your patients, especially when it comes to keeping up with the innovations such as the ones that the field of precision medicine brings to us. And so because we have heard of these challenges, we would like to actually hear it from you and go deeper into these challenges, because we would like eventually to give you a platform to brainstorm how does your care, daily life in care look like, and how could we collectively find solutions or learn from best practices that are out there so that we can support you in facing these challenges and providing ultimately a better patient care. So that's why this meeting is going to be mainly focused on you, and we are going to have around 40 minutes for you to discuss all together. And what we would really like to do with you is we would like to ask you to discuss some challenges that we've shared. Again, these are just initial findings that we got from literature and from a couple of interviews with you. But we would like to learn more. We would like to understand how those challenges look like in your daily life. What do you think about them? And then based on what you think is really important to address, we would like to start brainstorming what are potential solutions, and maybe see if in the room there is someone that has any best practice that they would like to share. So as you can see, the real focus of this call, of this workshop, and hopefully of the future ones as well, is really the power of the community. So before we get into the conversations and we leave the floor to you to discuss as experts, we would really like to pause for a second and stop sharing the screen just to see the beautiful faces that are here from this community. So I would ask if you feel comfortable, you can turn on your cameras as well so that we can start looking at each other and seeing the diversity that is in this room. Because this in the end is really what can make a difference. And we hope that with this meeting, we're providing you a platform to share with each other and providing you a platform to give you a voice, because we really believe your voice is fundamental. So that's beautiful to see. Thank you so much to see your smiles. I see someone is in the car. Thank you so much for joining us. I see someone is outside as well. That's beautiful. And I'm sure we will see also more faces within the breakout rooms as well. I invite you also over. Oh, I see more faces. Thank you so much. So I invite you to keep your cameras on in the room and to interact with the community. And if you don't feel comfortable with that, it's okay. You can use the chat. Whatever makes you feel comfortable. This is really your space. So I'm going to talk just for 1 more minute and then leave it to you just to explain you how the activity is going to look like. So let me get back to the slides just for a second. So we will use a tool that is called Group Map to support in the discussion. We will split you into smaller groups so that we can allow everybody to share if you would like to, and we can allow for more in-depth discussions. And as I mentioned, we will try in this first workshop to first understand what are your challenges and what are your support needs really, to improve in the way that you can deliver for your patients what you would like to deliver. And then we are going to try to shift the conversation to solutions. So we're going to start brainstorming together on potential ways in which these challenges could be addressed. And if any of you has any good case practice to share for the community, that's also a great opportunity for you to do that. And we would also love to learn more as FT3 in the future, and maybe invite you to speak in the next meeting as well. So 4 people, as Sally introduced us in the beginning, will facilitate these discussions. We have 4 nurses, so 4 of your colleagues, Celia, Silvia, Julia, and Ariesta. They will all moderate the different groups. And then 1 person from FT3 will support each of the groups. Within the groups, we will explain you how to use the tool. So now we'll stop talking and leave the word to you. Our colleague Silvia will now send you into breakout rooms and we can start the conversation.
Perhaps we can have a little bit of moment of sharing back. I will maybe share with you a few of the things that I heard from our group, but we would like just to allow, first of all, the moderators, Celia, Silvia, Julia, and Ariesta, to share a bit of their aha moments, right? Like I had so many aha moments. I was like, oh my God, I never thought about it, right? Or things you never heard before, something that you're like, oh, actually, you know what? We really need to follow up on this because it's sticking to my mind, but it's not a finished business. So I share a few things from my side, but I would like to invite the 4 moderators and then actually anyone here, please share it in the chat in the meantime, right? We would love to continue for another hour or so, but we cannot now. But please share in the chat whatever was your aha moment. From my side, in terms of like biggest challenges that I heard from my group was really in terms of recognition and acknowledgement. I had the perception that the nursing community really wants to make a difference and they really put their heart and soul in what they do every day. But it's very challenging, and sometimes there is not necessarily a recognition in the care team of even the efforts of, for example, taking a specialized course to be more prepared to having certain conversations. I also heard about the nurse shortages that definitely do not help, and the fact that the patient nurse ratio can be sometimes really challenging as well, and the fact that there is, elements like compassion fatigue, a lack of recognition also can lead to even more nurse shortages, because indeed it might discourage some nurses. And of course we heard a lot about the need for more trainings and language challenges, but I also heard a lot of passion in the group. So for me, I was really loving how towards the end of the discussion we were really thinking about how can we support nurses with information that can speak to patients, and they were talking about, for example, providing images, right? Like we often speak about booklets and so on, but like how about providing easy images that can help this discussion? So I could speak forever, but maybe I'll stop here and I'll hand it over to Celia for some of your aha moments, and please, anyone else, feel free to share.
That's amazing. I'm already like, I love that you get that feeling of what it's working with nurses, and that passion that we kind of overflow. We heard similar things on the challenges. That's terrible nurse ratio in many people. Also, how lack of education generally in oncology, how pediatric and adult nurses do actually get into the job with very little knowledge about oncology, so even less about precision oncology, and that takes them out of the job. Also, the difficulties of dealing with sometimes very advanced palliative cases where they are not getting the help. So the nurse sometimes is the support that they have, but at the same time, with that nurse patient ratio, is very difficult to give them the support. But there are 2 things that stuck with me. I don't know if it's my aha moment, but definitely what I take home. Some like how important it is that nurses, we are quite brave, but we need knowledge to be empowered. We heard, and actually we didn't speak that much about multidisciplinary team on the challenges, so they didn't see it as a challenge that much, but how much it came that MDT collaboration, how empowering it is to have a good relationship with oncologists, pathologists, to how much we need to continue working together. So I think that's something for us to keep fostering, that we are here nurses with nurses, but sometimes we need to join each other to actually lose the fear of talking to each other. How key it is that nurses are part of the MDT and they are listened to, so they can actually speak with their patients afterwards. And there was also a comment that brings back the idea of course, it's very difficult for patients that have to pay for it to do the testing, but at the same time, it's very difficult for, if you are a nurse working in an area that you don't have pathologist lab, it's very difficult for you to know if you are doing the right thing, because you don't have the pathologist or the lab in your own hospital. Sometimes you don't know who to contact. So something as simple as knowing where you can send the samples and who you can talk to may actually break a barrier of understanding what is needed from you and actually the results as well. So I'm gonna stay with that, because I'm sure Sylvia, Julian, and Aresta have many other ideas that may be similar. Sylvia?
Okay, thank you. I will. We don't have that much participants, only few, but despite that, it was very, very insightful and enlightening session. So, like Sylvia and Celia mentioned, evidently is a global problem of shortage of nurses. So I will not talk that much about that. But for me, some kind of aha moment was that one of the participants shared with us fact that they don't have oncologists specialist in their hospital, so nurses are left alone, with patients. So for me, it's a little bit unexpected, and it's very difficult to imagine how this works in practice. I guess it's very difficult, and for sure nurses in that particular hospital have lots of responsibility. Other aha moments, which I will like to emphasize, which was some kind, surprise for me. And just, for saying it's my personal thinking also, I will say regarding her voice, because we didn't have her picture. It is a young nurse, and she suggested, which I agree and support completely, that nurses first of all have to change their mindset. First of all, we have to much more confidence, and we have to think about us as equal partners and members of the healthcare team. And when we are thinking that way, all the members of healthcare team will be also consider us as equal partners. And we have also one question which I wasn't sure how to answer, so maybe one of you can take it now. Question was, does GPON or maybe some other institution consider about, defining some kind of guidelines regarding precision oncology for cancer nurses? I'm not sure. I don't have that kind of information right now. And just one more thing. Mostly all of the participants emphasized the need of education and research. And when I was talking about mindset, I wish to add that if we change our mindset about our position in the healthcare team, we also have to be aware that we have to learn and have to do lots of research, because our profession is, evidence-based practice. It's our ground. So we have to change that way of thinking. I would say that. So that's it for me.
Thank you so much. Who wants to share next? Maybe Julia from group 3, a few aha moments.
Sure. I think for me, the aha moment was the comment from a country in Africa where the nurse told us that the patients, when they hear they have the cancer diagnosis, they think it's an immediate death sentence. And that when they talk to the nurses and they learn more about the cancer and that treatment is available, that even though the statistics are pretty bad, probably 20% that they may recover long term, they get hope. They have hope. They will come to the treatment. They will stay in the treatment. And I think this is something that is not, we don't write about this a lot in nursing research and in the literature, but I think if a patient came and they thought they had no hope, they would not come back. Why would they pay the money for all this very expensive treatment? So I think if we ask why nurses are key to oncology treatment at all, or precision medicine, it's because they're one of the reasons the patients are returning to get the treatment. And then I think the other aha is, how are we going to really try to get the respect and the acknowledgement of the professional specialization? Because we had a lot of discussion. There were nurses in our group that had studied for 3 years to be specialists. They don't get paid extra. They don't get acknowledgement for being specialists, but they are specialists. And then even worse, it's being rotated off the unit to be in another field. So, or in another specialty area, ER or outpatient, general outpatient, something like that. So I think if we're looking at something like precision medicine, we have to ask ourselves, how do we retain nurses? Well, you retain nurses, and especially good ones who are specialists, by respecting their professional practice, acknowledging that they are specialists, and giving them, it's not always salary, it's usually the respectful environment where they are included in MTD. And I think for going forward with the precision medicine, which is going to be the future, even if you don't have it now, it's coming. I think that investing in those nurses and figuring out how to recognize them is going to be key, because they are clearly a major contribution to patients staying on treatment. Let me pass it on to Ariesta.
Yes, great.
Right. Thanks, Julia. Thanks, Sylvia, as well. I think you all have already covered what's discussed in my group as well. But what really struck me was that despite of the challenges, especially in the rural areas, so the nurses in my group are quite a number of them are practicing in the rural areas. So precision medicine is something that is quite there, but they're really eager to learn about the precision medicine. They're really eager to have the knowledge and training and workshop, and also they are eager to have more collaboration in the multidisciplinary team, and also more research. So in some areas, nurses in my group, they also shared that they have already have this precision medicine practice, and they're still improving. That the government also supported for the health insurance to cover more of the targeted therapies. So we have different contexts here, but they are all in all, they're eager to learn more and improve their practice in terms of the precision medicine. Well, that's all for me. Thank you.
Thank you so much, Ariesta. And thank you so much, everyone. It's really phenomenal. Like I'm definitely going back home today with a, big luggage of learnings and so on. And it's just phenomenal. So I thank you already very much now. I think the level of trust also, it's really remarkable. I think being able to come here and be like, okay, let's be a community, let's share what we all struggle with. But not only there, like what I really hear from you is like No, there is also a step after that. It's really about what do we do with it, so that we don't just get stuck with this is what doesn't work today, but also really thinking about, okay, let's roll up our sleeves and think about, you know, making it better. So thank you so much, because again, very rich. And I read in the chat a comment, you know, about having potentially more opportunities like this one. So absolutely, let's make it happen. And if we can move to the next slide, we have a few proposals for you. There are a few moments where we would like to meet you again. We would like to invite you. So we have, if you are interested in learning more about the FT3 program, we would like to invite you. Zioma just put the link in the chat. We would like to invite you at the next town hall meeting. The town hall meetings are meetings where we explain all the different things we do as part of FT3. Please feel free to join if you wish. We also have an upcoming virtual session around going deeper into understanding what is it that patients would love to see from nursing and pathologists at the point of care. So here it's really like, let's flip the coin, let's look at the other side. So here we are talking about how do we make it optimal for nurses. Next time, let's hear from patients. What is it that they would like to see? And I'm sure that we already know how much they appreciate the role of nurses, but it would be an element to go one level deeper. So again, Ozioma is sharing the link in the chat. If you want, we would love to have you. And then in March, we would actually like to have a follow-up conversation. So the GPON community is amazing. Again, thank you so much and all the people that are behind, you know, the GPON network. But we would like to have another GPON FT3 session, have a follow-up conversation on this, and maybe go one level deeper into thinking about solutions. Maybe we can invite other initiatives that have done great work and maybe can come and share how they have addressed some of these challenges. So we have opportunities to reconnect, and I personally look forward to that. In the meantime, if we can move to the next slide, there are a few resources that we would like to share with you in case you might find them useful. One is Precision Medicine Synapse. Synapse is a platform you can go and explore. It's a platform that tries to capture and map the existing organizations, initiatives, events, resources in the field of precision medicine. So we hope this can be helpful for you to find something that might be relevant to you tomorrow or in 2 months. So it's free, it's available to anyone, feel free to use. We're also sharing the FT3 Precision Medicine Toolbox. So as part of the FT3 community, we have created some tools that can be accessible to anyone. For example, in my group, they were discussing about the importance of having resources that nurses could share with patients. So we have some materials that if you want, we'd be happy to make available. So feel free to use and, you know, make the best use based on what would be best for you. And then, of course, feel free to reach out. So the FT3 team, you know, GPON network. So I know Annie is here, Celia, and many others like here that maybe I don't know personally as much are part of the GPON network. So let's stay connected. One more thing that I will bring on with me is the idea of being a movement. And I really think that GPON is doing an amazing work in connecting nurses globally. And we're very happy to see what we can do as FT3 to help and, you know, move it to the next level. So again, thank you so much. We are very excited, and we look forward to reconnecting with you sometime soon. So let's continue our journey together. It doesn't end today. And maybe one last thing for those who would like to have a certificate of participation, we would like to invite you to fill in this feedback form. And then you will be able to receive a certificate that can, you know, say that you participated in this session. So thank you so much to Celia, to Julia, to Silvia, to Ariesta, to everyone for being with us today, and hope to see you soon.
Thank you very much to everyone.
Thank you very much to everyone.
Bye bye. Have
Thank
a
you so
nice Christmas time.
Yes,
Hey,
holidays.
bye.
Have a nice
Thank
holiday.
you.
Bye.
Bye.
Thank you so
Bye.
much.
Thank you. Bye.
Bye, everyone.
Thank you.
Bye.